making assumptions is just a recipe for disaster.
Yeah.
Who is this? What's your relationship to my patient? Yeah.
And how I always say, is this a family member or say it like
Totally.
that, and you include it, like, because then you can find out how close this is
Totally.
or a friend.
Yeah. So we really need to avoid assumptions. And that's a common way to really mess up the trust in the relationship. But more than that, how do we sort of signal to these patients? So I'm on scene with a 14-year-old, and perhaps, I've been called there because the 14-year-old has expressed suicidal ideation to their parents, and parents have panicked and done the right thing and called for help. And so we're now there on scene with this 14-year-old. And this 14-year-old has a high burden of mental illness, and there's some significant distress and some mental health issues there. And how do I go, okay, I want this kid to know that I'm a safe person to talk to. So, I mean, one of the things you can do is wear a pride flag at work. It's incredibly powerful. And from my personal experience of wearing a tiny rainbow pin, it has been a conversation starter for so many patients that has opened up such an incredible dialogue of trust where I've been able to do like some of the best like public health promotion, general practice-y, long-standing care I think I've ever done as a clinician. That I make a point of having something a little bit rainbowy on me just to signal to my patients that if you're LGBTQIA, I'm someone you can trust. My current badge at work is a plain white name tag, and at the bottom, there's just a few little colors. It's subtle. It's not in your face. Um, uh, if I'm walking into a Catholic institution, no one's going to be offended by it. Um, Certainly, a lot of my colleagues wear the rainbow pin and rainbow lanyards at work, and I love it. I work in a really inclusive emergency department, which is such a blessing. Um, that is probably one of the things that you can do. But it's not just that. You don't have to plaster the ambulance with rainbows if you don't want to. The way you approach conversations can be an amazing way of building trust. So oftentimes when I'm seeing younger adults now, I'll ask, okay, hi, I'm Aiden. I'm going to be your doctor today. Would you like me to record your details on the medical record in any particular way? And they'll go, huh? But if they're trans, they'll go, yes, please. I use they, them pronouns. I go, great. I'll put that down. I had a case the other day where I had an intoxicated patient, and I asked them, hey, my name's Aiden. I'm your doctor. Is this your name? Yes. What are your pronouns? And I got the sense this is a young person. Um, they're probably going to be fairly open to me asking that question. And it totally shifted the course of the entire patient encounter. They had been like quite sort of reclusive and almost hostile to the team up until that point. And I asked them that, and their expression totally changed. And they said, ah, thank you so much for asking me that. And we had this amazing dialogue and this amazing patient, provider interaction. And we had a great chat. And I was able to ask about all their past medical issues and their family dynamic and, what they were doing for work and what drugs they were using. And they just felt really, they knew they could trust me in that. So the way we use language and the way we show sensitivity to people can be huge. Asking a patient, you know, hey, how you going? How would you like me to record your details in our records today? Is such an open-ended way of giving anyone the ability to say, hey, actually, my name's Cedric or James or something, but I prefer to be called John or Penny, Betty. Or this is my legal name, but actually this is the name that I prefer to use, or hey, these are the pronouns I prefer to use. So I think that's a huge one.
Yeah, that sounds good. I've got a little red badge with pronouns on it. That's what I wear.
Amazing.
Yeah.
Yeah. There's a company in Victoria called Badgie.co. A little shout out to them. They
Oh,
make
no.
the coolest,
I love business.
pardon?
I love a good small business.
Yeah, they're a small business. They're actually an alumni of UTAS in Sydney. Uh, Ollie is a paramedic in Victoria who runs the company, and it's an awesome company that makes pride badges, little things for uniforms, stickers you can put on name tags, little rainbows. They also have like support stickers that you can put on to support Aboriginal and Torres Strait Islander peoples, First Nations peoples. They even have little neurodivergent stickers. They have pronoun stickers. It's a cool website.
Send the link there and I'll put it underneath the show.
Yeah, unreal. We'll pop the link in the show notes. Um,
Some business way as well.
so one of the other things that I thought we should talk about is PrEP or Truvada, which is a common drug that you're going to see people on, particularly men who have sex with men, but also people who do sex work. It's tenofovir, and I always get the pronunciation wrong for this. Emtricitabine. There we go. There's a first time for everything. So this is a wonder drug, which has revolutionized HIV medicine. Essentially, people take one pill a day, and it is almost 100% effective at preventing HIV transmission. And so what that means is a lot of people, particularly men who have sex with men, will take this drug on a regular basis and will no longer, need to use condoms in order to prevent them from transmitting or receiving HIV. So for the first time ever, the rate of HIV has dropped massively in a lot of high-income countries, to the point where we had no new HIV transmissions in New South Wales last year amongst the gay community, which is unbelievable. So it's also one of the drugs that we use for post-exposure prophylaxis. So if you get a needle stick and that patient, you're not sure if they have HIV or not, you'd often be put on PrEP, but instead of pre-exposure prophylaxis, it'd be post-exposure prophylaxis for a month, let's say. So not only do I feel a lot more comfortable, as a gay man using this medication, but I also have taken it with me and used it whenever I've been practicing in environments where I'm more likely to get needle sticks and more likely to be in contact with patients who have HIV and are untreated for it or undiagnosed. So when I've worked in lower income and resource constrained environments overseas, it meant I was a lot more comfortable because I knew I was on PrEP and I couldn't get HIV. Obviously, there's still hepatitis B and C, and that remains a significant risk, Hep C from needle sticks. But PrEP is a very common drug. Hundreds of thousands of people take this drug. And so it's very common that when you're asking a patient what medications do you take, they'll say, oh, PrEP. Doesn't mean the person's gay. A lot of women also take it because it makes them feel reasonably a lot safer having sex, knowing that they can't contract HIV. Important point, it is only HIV that it protects against, not the rest of the STIs. So whilst there has been a dramatic drop in HIV, there has been a dramatic rise in syphilis, chlamydia, and gonorrhea in recent years. And the other thing is that there's now U equals U. Undetectable means untransmissible. So thousands of people in Australia have HIV, but they live completely normal lives and have even unprotected sex with their partners because their viral load of HIV is undetectable, which means it's essentially zero, which means there's no active HIV infection that can be spread. So when someone's treated properly and they have HIV, they live a completely normal life, to the point where there was a professor I was listening to a few years ago who stood up and said, I would rather have HIV today than diabetes. Because having HIV today, with the modern medicines that we have, it is so well controlled that you essentially live a normal, healthy life your entire life to an expected life, expected length of life, as opposed to diabetes, which is a life-limiting illness and has multiple complications. And I sort of sat back and I was like, wow, that's a huge statement. Now, things are all not, roses. Having HIV is still very much stigmatized in the community. It still has health risks. We still know that it makes you, even when successfully treated, slightly more likely to have different diseases later in life, particularly neurocognitive diseases later on in life. We're seeing a lot more HANDS, HIV-associated neurodegenerative neurocognitive disorders, amongst older adults who survived the early HIV epidemic and are now in their sort of geriatric years. But certainly, lives. And if we're able to create trust between us and them, and to maintain that trust and show them that, hey, I'm a health professional. Not only can you talk to me, but also I'm going to validate your identity, and I'm going to show you that I think you're cool or it's okay. It's an incredibly powerful way of creating a sense for these very marginalized patients sometimes that who they are is valid. And essentially that's one of those sort of key things that we all need in life is to have our identity affirmed. That's like part of the key foundations of mental health and well-being is to have who you are affirmed, to know that you're loved. And that can be really difficult to access for a lot of these people who have extreme stigma levied against them, and often, sometimes less and less, but still are rejected or not accepted by their family and close communities. It also sets them up for success later on with the rest of the healthcare environment. When we have a positive interaction with them and we go, hey, I'm a health professional and here's a really positive interaction, it allows them to go, okay, there are health professionals out there who I can talk to, who I can access care from. And even though later on I might have a negative experience with a few health professionals, it doesn't mean that they're all bad. Whereas if we're the first health professional they're contacting in a long time, and we provide them with a negative experience, we sort of set them up for negative experiences with everyone else later on in life. And we see that particularly in mental health care, in emergency pre-hospital mental health care, when someone has their first episode of psychosis. And unfortunately, we come in and we need to use some quite aggressive interventions in the way that we restrain them and sedate them. And unfortunately, the reality is we often traumatize people and set them up for negative healthcare interactions for the rest of their life. It takes an order of magnitude more effort and time to be able to build trust with someone after they are fearful and scared and distrusting of all health professionals. So to be able to come in and to create a positive interaction and a positive model for them, between them and healthcare, is potentially life-saving later on in life. And it's essentially thinking bigger than just the clinical interaction I'm having today. Yes, there's so much more you can get out of the patient interaction. You can be a better paramedic who takes better care of patients, that patient, but also you can set them up for success throughout the whole of their life as they interact with healthcare by creating trust between you and the patient. And creating trust between you and that patient essentially comes down to understanding the identity spectrum, speaking the language, and creating that space of trust by not making assumptions, by asking open-ended questions, by affirming that patient's identity, by having a bit more understanding of the